The way that chronic obstructive pulmonary diseases, or COPDs, including severe emphysema, are treated is changing. Bronchoscopic lung volume reduction is now a standard of care treatment option, and one such therapy is the Zephyr Endobronchial Valve, developed by Pulmonx. To get a greater understanding of this potentially life-changing procedure, I spoke to some experts in the field of respiratory medicine.
COPD is certainly one of the most frequent chronic conditions worldwide. It ranks among the third most leading causes of death across Western countries. And also in Austria, we do have an overall COPD prevalence between 5 to 7%.
If we focus on the UK itself and we look at COPD in patients over the age of 40 years, almost 10% of the population suffer from COPD.
We think that in France there are 7% of the patients who are suffering from COPD.
When you go to the numbers in Germany, we have maybe 5 or 6 million of people suffering on COPD, various disease stages.
Alone in the Netherlands, about 5 to 10% of our population suffers from different stages of COPD. Emphysema is heavily underdiagnosed because we can only see it and measure it by making radiological imaging, so a chest CT scan to analyze your COPD patient if the patient has emphysema. And not all patients do get CT scans, so it's pretty obvious that we kind of underdiagnose emphysema.
So one of the big disadvantages of traditional medicines is that despite all their utility and the number of inhalers and drugs that we have, they really do not have significant changes in patients with emphysema. This patient group effectively has irreversible disease, and therefore we need to look at alternative therapies.
And what is an endobronchial valve? How does it work? And how strong is the evidence to support this treatment option?
Endobronchial valve treatment is being considered as one type of bronchoscopic lung volume reduction for emphysema.
With emphysema, you get this hyperinflation, so the lung gets overexpanded. That in turn stops the diaphragm from working properly. So one way we can reduce the volume of that lung is by putting a valve in which allows air to escape from the lung but not to go back in. The amazing thing about this therapy is that it's very minimally invasive.
You get all the advantages of a surgical lobectomy without actually performing the surgery.
And the big advantage compared to other technologies is when it doesn't work, we can take the devices out and the patient is back to baseline. So the valves are the only reversible technology in that field we have at the moment.
And how do you test which patients are eligible for BLVR procedures, and what's the typical profile?
These patients basically used to either be on oxygen, or they're very limited in terms of their mobility. They're only able to walk very short distances before they have to stop. They tend to lose their weight. They become more and more withered. And also just minimal tasks were making them absolutely shattered and exhausted. So they had very poor quality of life.
So the story starts with the plethysmography. You need to be sure that your patient meet all the eligibility criteria, and for that you need to check the FEV1, which need to be rated at less or equal than 50%, and that means that the patient is suffering from severe to very severe COPD.
If we have evidence of severe hyperinflation in these patients, a CT is being performed, a chest CT, and upon this CT we can identify areas of the lung that are severely compromised and with evidence of emphysematous destruction.
And what endorsements does EBV have as a standard of care?
Now we can say that the Zephyr valve is strongly recommended, especially for patients suffering from severe to severe COPD with a very significant hyperinflation.
The GOLD guidelines were adapted so that they saw endobronchial valves for the treatment of emphysema as GOLD level A evidence. So that's the highest quality evidence.
EBV right now is regarded as a recommended therapy in the GOLD guidelines, but also by a lot of national guideline committees. Also within our country, it's a reimbursed and therapy for emphysema patients.
And what advice would you give to pulmonologists and GPs who have patients that fit the criteria for this type of treatment?
So the clear recommendation, you should look to your patients. If the patient is a COPD stage 3 or 4 patient, and you really have a typical signal of hyperinflation, send the patient to centers who are doing the valve placement on a regular basis.
We do have add-on treatment options available in patients that are still suffering from symptoms such as dyspnea as well as impaired exercise capacity. Unfortunately, some patients are being referred to us rather late when they have already very severely compromised lung function or very severely compromised clinical condition that may not be able to qualify for endoscopic lung volume reduction.
By selecting the right patients, putting the valves in, improving the quality of life, improving the exercise capacity, we really can give the patient additional months and years of life. We cannot stop the COPD, but we can improve the quality of life. So for me, in my daily doing, quality of life is the most important part.
When some of these patients improve, they get massive improvements. Their lung function improves by about 30%. They're able to walk again. They're able to comfortably go outside. They're able to go and get a pint of milk, get their newspaper by themselves. They're able to wash and dress by themselves. So not only are we giving them improvements in their lung capacity, what we're really giving them back is their dignity and their function back.